Meningitis is inflammation of the meninges. It's caused by an infection that reaches the brain. Younger children are particularly vulnerable to it. In fact, we treat fever in a child less than 3 months of age differently than we would in any other age group. Particularly in the first month of age, any type of bacterial infections that occur in the bloodstream can easily pass into the brain, and so often you'll be admitted, just for a simple fever, you'll often, under 1 to 3 months of age, depending on your pediatrician and what criteria they're following, will be admitted to the hospital for a full rule-out sepsis workup, which would include a workup for meningitis. As we get older, meningitis becomes less likely, but there are many different bacteria or viruses that can cause meningitis. Bacterial forms are obviously more dangerous, there are adult-type meningitis, for which we have a vaccine called Menatra. The most common cause of meningitis in young children is caused by a bacteria called Haemophilus influenza type B. The Hib vaccine protects against that. So we do have a lot of good preventative mechanisms in place that can help to prevent meningitis. But features of meningitis that you would want to look for is a high fever, neck stiffness, headache, and pain. That being said, in younger children it can be harder to recognize. A child who's under 3 months of age may only present with fever or even something as subtle as irritability, so it can be quite disconcerting when children have colic, which is a relatively benign process, because you just never know what's really going on. So make sure you discuss any of these concerns with your pediatrician.